Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone, and welcome to the broadcast. And what a broadcast we have planned for you today. Believe me on that one. The University Hospital Seidman Cancer Center opened in early summer 2011, the first of its kind in this region. This center brings together state-of-the-art diagnostic and treatment and technologies in one building. Center Director Dr. Stan Gerson is here to talk more about the facility. Then later on, we will hear from Wendy Miano about what patients had to say about this new facility. And later in the broadcast after that, Hermione Malone will talk about the center's community outreach programs. It's going to be a very good broadcast today. Good morning again. I'm Leon Bibb. This is Kaleidoscope, and so we begin. Beginning with Dr. Stan Gerson, Director of University Hospital's Seidman Cancer Center. Good to see you again, Dr. Gerson.
Good morning, Leon.
Yeah. Things are going well for you, I would imagine. You opened this summer at the big Seidman Cancer Center at University Hospitals.
It's been an astonishing experience. It's fully open, fully occupied, fully functional, and it's a really amazing facility for all of our patients in Northeast Ohio.
What makes the Seidman Cancer Center and University Hospitals so unique?
We have made a commitment at University Hospitals for cancer patients and for cancer care, and what the Seidman Cancer Hospital represents is a unique facility totally dedicated to cancer for patients with cancer and who have a new diagnosis of cancer.
Now, this is everything under one roof.
Everything under one roof, whether patients come in for a diagnostic procedure, for an imaging test, for blood counts, for treatment, to see their physician, to go through surgery, or to be in the hospital. We have 120 beds totally devoted to cancer patients.
What's this mean for this region of the country?
Well, this is the first time for Northern Ohio that we have a dedicated tertiary care facility where everything that a patient needs for sophisticated care and technology for cancer treatment, new innovative treatments, new surgical technology, treatment and clinical trials can happen under one roof. Most importantly, for the cancer patient and their family, they can come to one place, and they don't have to flit around to all different locations and to look for physicians of one or another specialty.
One of the things I learned when I did some research on this, you've got floors, each designated and designed for specific kinds of cancers for those patients. So they're not all tossed together. And I don't mean to be rude by using the word tossed. They're not all put together, but they're different floors. Speak to that a little bit.
Sure. So we have one floor that's specifically designed for our bone marrow transplant patients, patients undergoing a cell therapy or experimentation for new types of treatment. A second floor for medical oncology, where patients are receiving treatments or the follow-up of treatment for a variety of cancers. A woman's cancer floor, because of the special needs that women have, and a regular surgical oncology floor for post-op and pre-op treatment and management of patients who've just had a surgical procedure.
There is a key component of the Seidman Cancer Center at University Hospitals that really intrigues me, how you bring in the entire family. The entire family is treated. Can you speak to that a little?
Well, sure. So we've been very attentive to the fact that patients with cancer rarely go through that treatment all by themselves. The family needs to be involved, and the family needs to be there for decision making. There are many, many decisions that have to be made, and we make sure that our physicians round in the room. We encourage family members to be there. In fact, we can let you know when we're going to be coming through. The rooms are large enough so that not only is the patient well taken care of, but there's a side space right there in the room for a patient who wants to spend the night with their family member, right in their attendance. And there's a curtain. We can separate the spaces out. So we make sure that all the amenities are there for patients and their families, and that the families feel comfortable to be in the room with us while we're talking about the special issues that come up.
Psychologically, this has got to help that patient and the family as well.
Absolutely. The other key thing in patient decision making is, are the physicians talking to each other? And we can assure every single patient that comes to see us that their case is presented at a multidisciplinary conference where all of the physician team experts come together and review every case before a decision is made about patient management. So they're getting second, third, and fourth opinions before they even know it. So that should also be very comforting.
This Seidman Cancer Center certainly has added to the Cleveland skyline, certainly in University Circle. It's just a wonderful looking building. I've got to believe that other medical facilities around the country are looking at you guys, saying, are they coming to you getting ideas on how they can perhaps duplicate this in other parts of the world?
Absolutely. We've had people both call and come from across the country, as far away as Seattle and Washington, to come and look at our facility and see what we're doing and learn from both the physical plant and the amenities that we've talked about, but also our style of medicine. We have the most advanced cooperative, coordinated efforts in patient care anywhere in the country.
Were there any surprises that you were hit with once you got this off and running in this summer in 2011?
You know, the most amazing thing to me is we've designed the building for about 3 years and built it for 2 years. And I was amazed within the first 2 weeks or so of moving in that it all worked. That things are in the right location. The patients tell us it's easier to come through and receive care here than any place else that they've been within our system. And the facility, the personnel, the physicians, the nurses, the staff are all excited to be there. It's been really a special experience.
You still adding staff? Still need staff? More staff?
We absolutely are. We're still hiring. We're still gradually expanding up our bed count with nurses and support folks. It's really been quite an amazing effort.
As the director over there at Seidman Center, let me ask you the $64,000 question a lot of people have on their minds. Are we making big inroads in cancer?
The first thing we have to do is to make sure that we're most efficient with the care that we can provide today, and certainly that is better with the Seidman Cancer Center. Another aspect of our abilities is an improved intraoperative imaging system, so that I just received note yesterday from one of our neurosurgeons who was doing a surgical case on the brain to remove a brain tumor, and in the middle of the operation he was able to swing the patient over to an imaging system called an intraoperative MRI. He realized that there was a small piece of tumor that he couldn't see that was still there. He swung the patient back, finished the operation, so that patient had a better operation with a shorter period of time. I didn't have to go back for another operation or be told after the surgery that there was still tumor left. So that's the technology that we can use with this new facility.
That is a great story. Dr. Stan Gerson we're chatting with. This entire broadcast today is going to be about university hospitals and the Seidman Cancer Center. Dr. Stan Gerson was with us for our first segment, and we're going to continue talking about the Seidman Cancer Center. I've got to take a break right now. When I come back, we'll talk to Wendy Miano, Chief Nursing Officer at Seidman Cancer Center of University Hospitals. Back shortly. Thank you, Dr. Stan Gerson. I recently toured University Hospital's Seidman Cancer Center, then sat down and talked with Chief Nursing Officer Wendy Miano. She explained that patients had the opportunity through a patient's council to give their input in the design of this new facility. Tell me about the Seidman Center. What do you see as its chief calling card?
Chief calling card is bringing all of our cancer services for patients and families under one roof, and in that roof being able to bring state-of-the-art technology and a team approach to cancer care.
Tell me about the patient input. Why was it so vital in the construction of the Seidman Center?
We had a unique opportunity through our architect to bring together a design team of patients and families. And what we asked them to share with us is how to make the experience more comfortable and healing. And so I think what they contributed to us were very simple amenities that completely changed the ambiance of the space.
A patient council was involved in this. Tell me about what it did.
We pulled together a group of patients and families really as part of a design team for the construction, and then with that team decided let's keep the council in place and seek additional input for program development, and really the goal being to help us improve our quality and remember the care from the perspective of the patient and family member.
So that's really the keystone of this, from the perspective of the patient and the family members.
Yes.
Yeah. I'm intrigued by that. Talk a little bit about how the family is so widely considered here.
Because cancer is a pretty complex this disease in terms of treatment. You're going to be in treatment for usually a year or longer. You need a support person, and it may not be a blood family member, but maybe a good friend or a partner who's there to be a caregiver and a coach and a cheerleader when times are getting rough. And so that family member really is the primary support to our patient. And it's come to be that if someone is experiencing an illness, we need that caregiver, that partner, to help interpret the plan of treatment and what the patient needs to do once they leave the hospital. So it's really, I mean, it's truly a partnership, and I would say over 80% of our patients are coming with a family member or a friend who's there, and they expect to participate in the decision making and be acknowledged in terms of what they're bringing, because typically family members are taking in information about what treatments are available, you know, what exercise or diet considerations can help their loved one get through the treatment.
You have something here called the environment of healing. Tell me about that. What is that?
I think when you walk through this space, what becomes relatively apparent is the lightness and a warm tone. It's quiet. It has art that's appealing and whimsical. You've got a view out to this healing garden, and people are drawn, I think, at a time of crisis, which cancer treatment can be, to the physical space.
As I look at this space that we're using right now for this interview, I notice the fireplace, which is simply relaxing just to be here.
Yes.
And the floral treatment and the lighting, that's all part of the treatment here.
Right. We want to create a home-like environment, and not necessarily a hotel-like an environment, but an environment that's warm and appealing and comfortable, so that if you're feeling down or frightened, the space doesn't further contribute to that fear, but really helps to, you know, settle you down and make you feel less anxious.
Wendy Miano, you're the chief nursing officer here. Certainly you get feedback from the patients and their families.
Yes.
What has been the feedback?
The feedback has been overwhelmingly positive in terms of the physical space, and probably still the most important aspect of our care are the people. The nurses, the physicians. It's, you know, having a beautiful building is all well and good, but really what makes a difference in that patient and family approach is how am I treated? How is the physician and the nurse interacting in terms of communicating about my plan of care? So I'm asking patients and family members very specific questions about how well are we coordinating your care? What can we do better? Give us an example of where we might improve, because that's what, after all, we're all about, is getting better at what we do. And so the physical space is an A+, the staff is an A+. I think areas that we still need some work on are being attentive to patients needing rest through the night and how to coordinate the care so it's not constant interruption through the evening, but, you know, allowing for rest and allowing for choice for patients.
Wendy, tell me, what touches your heart and soul with all of this here?
My passion is putting the patient and family first, and when I have the ability to watch our staff and physicians interact with patients and families, and they feel that they're not only cared for in a medical sense, but also an emotional sense, that to me is the passion that drives me here each and every day.
Wendy Miano, Chief Nursing Officer here at the Seidman Cancer Center at University Hospitals. Thanks for being with us. And this is Kaleidoscope. We are going to continue talking about the Seidman Cancer Center. Up next is Hermione Malone. She's the manager of community outreach for the Seidman Cancer Center at University Hospitals. We'll talk with her after these words, especially for you. You're in touch with the Kaleidoscope broadcast. I'm Leon Bibb, and we're awfully glad to have you with us today. We're continuing our discussion about the Seidman Cancer Center at University Hospitals. Up next is Hermione Malone, who is the manager of community outreach for the Seidman Cancer Center at UH. Good to have you with us, Hermione.
Thanks for having me.
Good to have you. Tell us about the community outreach program. First off, what does community outreach do? What does it do?
At the Seidman Cancer Center, we have a distinct commitment to serving the needs of the underserved in our community. And particularly in cancer, we see a lot of disparities, both in incidence of cancer and in those who survive. And so all of our programs are really designed to help reduce those disparities that we see in cancer incidence and cancer deaths.
By the underserved, what do you mean?
Typically, if you look at socioeconomic status, oftentimes African American populations have a need for greater attention to get into screening and treatment because of high incidence and death rates. A startling example of that is breast cancer, where African American women actually are diagnosed with cancer less, but die from breast cancer more.
What are some of the issues that may prevent individuals from seeking medical care?
The most obvious one would be a lack of access, so really living in a place where you don't have tremendous access to care. Another is fear. Fear is a tremendous hurdle that keeps a lot of people from seeing a doctor. Lack of insurance is another example. People have economic issues that prioritize their health at the bottom if they've got to worry about food and shelter at the top.
So with community outreach, you go out and try to alleviate some of these fears, try to get around these fears, try to get around some of these socioeconomic problems, and get folks to come in to the cancer center for various screenings and things, and for treatment, of course.
Correct. We absolutely use education to help diminish fear, and we use free screening programs to help increase their access.
You have a free mammogram screening program coming up in September. Tell me a little bit about that, and explain some of the things that we're looking at right now. Take a look at the monitor there.
So this is actually located in the new Seidman Cancer Center. It's our Wolfgang Puck Learning Resource Center, and it's a place in the hospital where patients or families can come, get information. There's educational material, there's access to the web. We will have a librarian staffing that shortly, and there are also cancer information nurses who are there and able to assist with questions.
We've put up a graphic about the free mammogram program. You want to talk a little bit about that?
Absolutely. This is something that we host once a month on the third Saturday. It's absolutely free. Women just need to call and make an appointment. We cover transportation and the cost of the mammograms. It's co-sponsored by Susan G. Komen for the Cure, McDonald Women's Hospital, and it's part of a larger package of programs we have called Save Our Sisters, which is designed to reach particularly African American women.
Save Our Sisters. Now, talk about that. You've opened the door on that one.
Save Our Sisters is an umbrella for several programs. The first is Project Temple, which does education programming throughout the year for African American women 40 and over. It teaches them about breast cancer, breast health, the importance of mammograms, and the great thing about that program is that it connects them with a health advocate. So if a woman has issues overcoming her own barriers to get care, that health advocate works one-on-one with them. The Breen free mammogram program that we just mentioned is one of them. As well, we do mobile mammography, where we will go out into a community and take a mobile unit to do screenings, usually at a church or a school or something like that, so people really can just come from their homes and get the care that they need.
Hermione, that's from the woman's point of view. Let's talk a little bit about the men now. I know there's a program designed for men who are notorious for not going to the doctor. We work on them every day on this broadcast, every week on this broadcast. You've got a program geared for men.
We have an education program that looks at prostate changes, that try and get men to understand what their prostate is, what changes may be, cause for them to call a doctor, that not everything is cancerous, but that you do need to reach out and speak to your physician. As well, we have a body and soul program that works with churches, so that's sort of gender neutral. Yeah. The idea is to get congregants to eat healthier to help reduce their risk of cancer. Smoking and diet are the #1 things that can contribute to increased risk for cancer.
So there are a lot of things that we can do before we get cancer.
Absolutely.
To try to stave off that, hold that off if we can by a healthy lifestyle. What challenges do you see? I've got about 45 seconds remaining. What challenges do you see that we need to be addressing right now regarding this whole thing?
I think there's a tendency to look at the healthcare system or healthcare to say, you know, this is a problem of people's health, fix it. But there are a lot of need for voices to come together to the table. So we need, you know, police and parks and rec so that people can get out and walk safely in their neighborhoods and get the exercise they need. Folks need access to green grocers. It doesn't do a lot of good to tell them to eat healthy if they can't locate any fruits and and vegetables in their neighborhood. So I think there needs to be a greater collaboration in Greater Cleveland to really address some of these disparities at a larger level.
Thank you so much. Hermione Malone, who is a manager of community outreach at Seidman Cancer Center at University Hospitals. And by the way, the phone number for everything we've been talking about today, you can reach it at 800-841-2422. That'll put you in touch with the Seidman Cancer Center. Or you can go to uhseidman.org, and Seidman is spelled S-E-I-D-M-A-N, uhseidman.org. Everything we've been talking about, you'll find it reflected on the website, or you can get information on the telephone. Thank you, Hermione.
Thank you, Leon.
Good to have you on the broadcast. I'll take a break in a moment. Marsha Maccabee of the Urban League. Here now is Marsha Maccabee, president of the Urban League of Greater Cleveland, always with a comment. Hey, Marsha.
Hi, Leon. Good to see you.
Good to see you, too.
Good to see you. Been gone a little while, but I'm glad to be back.
Okay.
Really excited about the broadcast today, talking about University Hospital, the Seidman Cancer Center, and all of that. And what it just really pointed to is that with this being such a great center for health care here in Cleveland, we have absolutely got to make sure that our young people are learning science, technology, engineering, and math so that they can be ready to work in the field.
You know, one thing, you know, people talk about jobs and the economics. Jobs are available in the healthcare industry.
No doubt about it. We want to tell
the young people that, and the middle-aged folks too.
That's right.
You know, jobs are available in the healthcare industry.
That's right.
And this is a good town to be in for healthcare.
It certainly is. And if our young people aren't prepared and ready to step into those jobs will be filled by people from other countries. So we really need to be about making sure that we grow our talent here.
Homegrown talent, and we can get jobs here. That's one of the things the Urban League is always talking about developing your own skills, taking what is given to you, which is that education, and then running the ball with that education. It can make all the difference between living a good life and living a life that's not so good.
That's exactly right. And in today's economic climate, it is all about economic empowerment and really creating jobs and beginning to get those jobs back. And we don't want to take our focus off of that for a minute. We can get distracted with a lot of other things, but that's important to our economic recovery.
Always, as I said, words of wisdom always from my good friend Marsha Maccabee of the Urban League. That's going to do it for Kaleidoscope. We've had a good broadcast today. Be well, everyone.
Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.